Severe symptomatic aortic stenosis is often treated by surgical aortic valve replacement, or SAVR. Transcatheter aortic valve replacement, or TAVR, has emerged as an alternative to SAVR. There have been randomized trials comparing the two methods in low-risk patients, notably the PARTNER 3 and Evolut Low Risk trials with early-term follow-up. Here, the authors examined long-term real-world outcomes of low-risk patients undergoing isolated primary SAVR for severe aortic stenosis in the United States. Individuals undergoing primary isolated SAVR between 2011 and 2019 were selected in the Society of Thoracic Surgeons Adult Cardiac Surgery database and linked to the National Death Index. Among them, 42,586 patients satisfying the inclusion criteria outlined by the PARTNER 3 and Evolut Low Risk trials were analyzed. The mean predicted risk of mortality after SAVR was 1.9% plus or minus 0.8%. The late all-cause mortality of patients undergoing isolated SAVR at 1, 3, 5, and 8 years was 2.6%, 4.5%, 7.1%, and 12.4% respectively. The authors found that the longitudinal overall survival after SAVR was excellent, at greater than 90% at 5 years, and even better if the predicted risk of mortality was below 1%, or the patient age was below 75 years, reaching 95% at 8 years. Given that the present study evaluated survival beyond the time points used in current comparative trials, the obtained data may serve as the new benchmark for current and future trials comparing SAVR and TAVR.